Graduates, you may be seated. Good evening. I am Lisa Breggy, the Nursing Program Secretary, and I would like to welcome you to tonight's ceremony. We are delighted and thankful to have you here tonight to share in this time-honored nursing school tradition. The pinning ceremony is a rite of passage for nursing students. It is held to welcome our newly graduated RN and LPN nurses into the profession of nursing, transitioning them from student to full-fledged nurse. The nursing program mission is to design and direct student-centered, evidence-based educational experiences. These experiences are designed to facilitate growth, promote lifelong learning, and produce safe and competent practicing nurses. Tonight, the program's mission has once again been achieved, as 26 students will soon be on stage receiving their pins. We are grateful to have many members of our ACC family with us tonight, showing their support for our nursing students, including Don McMaster, the President of ACC, Director of Nursing Melissa Fournier, Vice President of Instruction Deb Baer, and members of the ACC Board of Trustees, including Chairman John Briggs. On behalf of the Nursing Department, I would like to thank Penny Boldry, Executive Director of the ACC Foundation, for her 16 years of service at ACC as she prepares for retirement in June. Penny, your dedication to finding donors to establish scholarships for our nursing program has made a lasting impact in many student lives. Thank you. Before I hand over to Diane O'Connor, I want to acknowledge our LPN and RN graduate students. A lot of hard work goes into earning a degree in nursing, and you have finally done it. Congratulations.
So welcome everyone, and to our graduates. So here you are. The outcome of a decision you made a few years ago that you wanted to be a nurse. Since that time, and since that decision, much has happened in your educational process. Your classroom has not only been the traditional lecture room with textbooks and PowerPoints, exams and quizzes, but you've also experienced the real-life classroom of taking care of real people who have real problems. In your clinical experiences, you've seen the joy and pride that a new life, a new baby, can bring, and when so much lies ahead for them. And you've seen the sadness when time will, in fact, be shorter. You've taken care of people whose life will change due to a diagnosis, and you've seen, touched, and smelled real life in its rawest form. People, when they're vulnerable, those struggling with mental illness, those with the multiple complications that come with chronic illnesses. You've been witness to feelings of hopelessness and helplessness. So, you've monitored and administered care to these people, investigated and documented, become skilled in assessment and critical thinking. You've observed and treated physiological processes, and you've accomplished all of this by applying critical thinking and a skill base that comes with a growing foundation of knowledge. You've comforted. You have functioned in a world that melds high technology with the simple human touch. So how does this all happen? Your family and friends might be wondering about this right now. Well, as students, you are very familiar with the objectives that comprise the core of how you are evaluated and assessed throughout this program. In all, the ACC nursing program employs 6 core objectives in your learning education, and they are, hopefully you know these, professional behaviors, the development of professional behaviors, communication, you need to communicate effectively and thoroughly, certainly identifying and developing caring interventions, clinical decision-making, very important, collaboration, the art of working together, and teaching and learning. That will be a lifelong endeavor. You will never stop advancing your knowledge base. For our audience, the students have assembled a PowerPoint presentation that demonstrates these very high ideals they were held to as a nursing student at ACC. And they would like to share this with all of you. Nate, can we please have the lights dimmed? So if everybody can direct their attention to the left of the stage, our screen. So the first point, professional behaviors. I can tell you that this group was always focused, razor sharp attention in the classroom, attuned to the learning process, and invested in forming the interpersonal connection necessary for the patient-nurse relationship, which is research proven to improve patient outcomes, really. And that's just adorable, just have to say. From day one, they took this educational process very seriously. I can attest to that. And then in communication, our second learning objective, they utilize state-of-the-art communication devices so necessary and vital in medical care. They gave each other supportive and constructive feedback. And as they were instructed, always communicated directly with each other and other members of the care team. We're so proud. In caring interventions, so the skills for applying appropriate treatment to patients, they learned how to appropriately use life-saving equipment. They always followed the stated safety guidelines in disposing of contaminated and sharp objects. They followed the #1 rule, which is never, ever, never, ever stick your finger into that little red box where all the sharp things are. And you guys never did that. No, never. Huh, phew, okay, good. Never mind the picture. And at times things did not go perfectly, and maybe there was not a really good explanation for this, I don't know, so then we just move on, okay? Can't explain. In decision making, so our fourth learning objective, all decision-making processes were backed with scientific research evidence and thoughtful consideration of all variables. There was no eeny, meeny, miny, moe in this. They learned to critically evaluate every situation. And you know, if you really can't do anything, well, you just can't. You just can't. Sometimes. That's the way it goes. So collaboration. They always work together to meet their objectives, and I can sincerely tell you I felt this. I did. felt they worked together. This group was always willing to help one another in every way possible. I think they were taking a test there behind my back. They collaborated in safe management of patients while maintaining patient dignity always. It's very, very high priority. And they sought assistance and sought input and advice from colleagues when unsure, because collaboration equals strength in the decision-making process and equates to better outcomes. In teaching and learning, well, I can tell you they never gave up. They just kept trying. And I mean, they never gave up, ever. They investigated. They used all 5 senses in the evaluation process. And they certainly always demonstrated fiscal responsibility, never wasted supplies. Is that true, you guys? Did you ever waste supplies?
No, never.
Oh, good, okay. They improvised when necessary. Use what you have for a hat, if that's necessary. They showed appropriate use of lab time and lab supplies. Lab time reinforced professionalism and mature behavior, of course. So, who are these masked superheroes? Well, I'm proud to say they are ACC nursing class of May 2018. Woohoo! So congratulations to our ACC RN and LPN nursing class. Welcome to the nursing profession. And in all seriousness, your instructors and your family, we're all so very proud of you.
We'll now move with the presentation of the LPN pins, if the LPN class wants to rise and prepare for pinning. Pinning is a rite of passage, and part of this rite of passage is to be pinned into the profession by another nurse. So some of the graduates have elected to be pinned by nurses that are close to them, family or friends. So we'll try to get everybody's name right. If the pinners want to come forward and line up behind me. What's that? So the first LPN 2018 being pinned is Cody Beldner. Pinning Cody is adjunct faculty Shelley Thomas. Michaela Belmore. Haley Britton. Pinning Haley is Judy Stump. Rebecca Brown. Jacqueline Hart. Pinning Jackie is her mom, Christy Hart. John Kozlowski. Jameson Robarge. And our first graduating from high school, as well as graduating from the LPN program, is Kelsey Shea. Our first early college. Emily Spleet. Brianna Wint. And Jenna Keshke. I'm sorry. I tried. Where are you going? I give you the LPN class of 2018. You may be seated. All right, will the RN class prepare for pinning? Our first RN graduate is Jamie Achabachi. Rachel Havner. Penny Rachel is Patricia Sherry. Okay, next we have Kendra, AKA Kenny Haskey. Pinning Kenny is Frankie Kutchman. Taylor Kozlowski. Kowalski. All right, Kowalski. Pending Taylor is Mary Vakarish. Fawn Nathan. Caitlin Reesner.
Congratulations. You're going to go places.
Crystal Samuel. Pinned by Delynn Greentree. Courtney Zauer. Pinning Courtney is Justin Metke. Megan Schultz. Pinning Megan is Lisa Schultz, who just got out of work. Jana Schubert. Pinning Jana is Mr. Joe Schubert. Her hubby. Jessica Shrebnick. Pinning Jessica is Katie McCurry. Caitlin Tralfa. Pinning Caitlin is Jenny Spoomer.
Get over here. Congratulations.
Ashley Vandiat. Caitlin Wade. Pinning Caitlin is Amanda Klein. Ladies and gentlemen, your 2018 RN graduating class.
I now welcome Courtney Zauer and Caitlin Truffa to the stage for their presentation.
Hello and welcome to tonight's pinning ceremony. My name is Courtney and I serve as the president of the Student Nurses Association for the duration of the spring 2018 semester. The Student Nurses Association serves as an advocate for nursing students within Alpena Community College and participates in many events throughout the community. I would like to take the time to thank all whom participated in this semester's events. I invite all officers and board members to stand when introduced for recognition. Jeremiah Brusso, Vice President. Carolyn Doobie, Treasurer. Jessica Schrebneck, Secretary. Jamie Achabowski and Emily Spleet, Pinning Committee Chairs. Caitlin Truffa, Community Service Committee Chair. And our board members, Toby Brunetti, Haley Britton, Paige Shumera, Michael Mativier, Jameson Robarge, Jenna Dowling, Zachary Spence, Brianna Went, and Haley O'Mara. Also, every semester, the student nurses choose a nurse whom they found to be inspiring. This person was very patient with all of us and remained calm in all situations. She always took the time to teach us and involve us in patient care, as well as additional opportunities. This semester, our inspiring nurse is Kayla Brewski from OB. Kayla, please come forward to accept your award. Thank you.
Hi everybody, my name is Caitlin and this semester I was the community chair representative for the Student Nurses Association. Each semester we raise money through different raffles and fundraisers to give back to our community at the end of the semester. So this February we started with the Hoops for Hope game, or the pink game, with the ACC Lumberjacks right here in the gym. Everything we raised for that was donated right back to the District 4 Health Department's mammography fund. In March, we worked with the American Red Cross and Holy Blood Drive right here at ACC. We were able to exceed our set goal and received enough blood to be used to save over 150 lives. Just recently, we had our first Pie in the Face fundraiser. I'm happy to announce that it was a huge success. We had cans set out throughout the college, and every dollar that was donated to a teacher or a staff member counted as 1 point, and whoever had the most points received a Pie in the Face. We received over $400 in donations. The money that was received from the donations was used to help us make a donation back to Alpena Sunrise Center. We were able to collaborate with Young's Appliance and Alpena Furniture to purchase a brand new couch and love seat set. I would like to thank Young's Appliance and Alpena Furniture for allowing to make that happen, and I would like to invite them along with the Sunrise Center up to the stage to accept their awards. No. I also want to say congratulations to both the following classes. You did an amazing job this semester. We did it. We're all done.
And now Diane O'Connor and Barb Jackelman will present the awards to the LPN students.
So every year in both the LPN class and the RN class, students are chosen for awards. And these are students who have excelled in certain areas of their nursing education. The first award we're going to present tonight is to a student who has demonstrated excellence in nursing theory in the LPN class. This is an award given to the student who has excelled in the knowledge of nursing theory. And our recipient is Haley Britton.
Congratulations.
Our next award is for excellence in clinical practice, and this award is given to a student who has demonstrated a high proficiency in clinical practice. And our recipient this year is Jameson Robarge. Our next award is the LPN Classmate Appreciation Award. And this award was established by the LPN class of 2005, and this award is given to a classmate who is recognized by the entire group for their outstanding personality, attitude, and overall contribution to the class. So the students choose this award amongst themselves. And this year's recipient is Jameson Robarge. Hallelujah. Our next award is the Judy Beyer Award in honor of this Level 1 nursing instructor. This award was established by the Student Nurses Association in 1994. It is given to a student with a GPA of 3.0 or higher who has had a minimum of 10 community service hours and demonstrates those qualities of compassion and caring as well as expertise of which Judy Beyer felt were important to be a professional nurse. And our recipient this year is Michaela Belmore.
My name is Barb Jackman, and I'm honored to be here tonight to present the Barbara Jackman BSN RN Endowed Scholarship. It is awarded to a full-time nursing student who has successfully completed the Level 1 program and will be continuing on into the Level 2 program. It is currently for $250. This award is selected by nursing faculty, and criteria include: the student communicates well with his or her patients at the bedside and teaches his or her patients. The student displays eagerness to perform every patient care procedure available to him or her at any time. The student is always enthusiastic and demonstrates a positive, caring attitude. The student is prepared with the information needed to carry out the task he or she is to complete for each shift. And finally, the student helps and supports his or her nursing classmates. So I'm honored tonight to present this award to Jameson Robarge.
And now we have Melanie Thomas presenting the RN Awards.
Hello. The first RN award is the Excellence in Nursing Theory. This award is given to a student who has excelled in the knowledge of nursing theory, and this award goes to Crystal Samuel. The next award is the Excellence in Clinical Practice. This award is given to a student who has demonstrated a high proficiency in clinical practice. This award goes to Jana Schubert. The next award is the Catherine Reichert Gwen Award. In honor of a Level 2 nursing instructor, this $300 scholarship award was established by the Nurses Association in 1994. The award is given to a student who has successfully completed the clinical portion of the RN program while maintaining a minimum 3.0 GPA. The student has also demonstrated a dedication to quality nursing by showing an initiative in seeking out new experience, achieving academic excellence, and maintaining a high level of professionalism. Again, this award goes to Jana Schubert. The next award is the Holistic Nurse Award. Established by the RN class of 2005, this award is given to an RN student who encompasses the characteristics of holistic nursing approach. These characteristics include exhibiting superior competence in clinical and theory classes, showing compassion and enthusiasm in everything they do. This year, two graduates will be receiving this award, Crystal Samuel and Caitlin Wade. The last award tonight is the Helen Malandrinos Award. Helen Malandrinos was the ACC Director of Nursing from 1982 through 1989. This $250 scholarship is given by the ACC Foundation to a student who exemplifies those traits that Ms. Malandrinos felt were most important to the beginning of a successful nurse. They include integrity, leadership, scholarship, and community service. This award goes to Jamie Ektebowski.
I now invite Caitlin Reesner and Cody Bellinar to the stage to give their student addresses.
Good evening, everyone, and thank you for coming. This is a day my classmates and I have been looking forward to for what seems like an eternity. We are all very thrilled to be here. It's hard to imagine that it was only less than a year ago we started our adventures in nursing school. I still remember our first day. Miss Fournier came in our classroom and explained to us what to expect in the nursing program. One of the things she said, and she just said it very plainly, you're not going to get straight A's. Don't expect to get straight A's, and don't be disappointed when you don't get straight A's. I thought to myself, oh yeah? Watch me. I could do it. The first week, we learned how to wash our hands, make a bed, don personal protective equipment, and navigate ATI. Easy enough, right? I can get straight A's. Well, not exactly. By the fourth week, we were drowning in the 8 different chapter reading assignments between classes, which each consisted of 30-plus pages, mind you. Studying for exams, and of course, still trying to navigate ATI. On top of learning an entire new vocabulary of medical terminology and the infamous select that all apply questions, we were to answer questions that consisted of entirely correct answers, and as nursing students, we had to decide which one was the most correct. At this point, I concluded it was safe to say that Ms. Fournier was being quite realistic about the straight A situation. Nonetheless, we pushed on. Through the endless reading, making stacks upon stacks of flashcards, watching countless videos repeatedly on ATI, and maybe crying ourselves to sleep every now and then, we managed to survive. Using our friends as test subjects for the numerous assessments and treatments we learned in lab was also a must. However, that luxury was short-lived for myself, as a lot of them flaked out when I told them that we were learning about how to insert Foley catheters next week. As we progressed through clinicals in the rest of our classes, we slowly but surely became a little less shaky when giving injections, a little less nervous when being drilled on medications we were about to administer, and all the more confident in providing the care that patients deserve. However, I believe I can speak for everyone when I say that this is one of the greatest challenges we have ever faced in our lives up to this point. And now, after the sleepless nights and what seemed to be endless anxiety, we are being pinned as LPNs. On behalf of my class, I would like to thank the staff at Alpena Community College for being so helpful and kind to us in our journey. I'd like to give them all a round of applause, please. I would also like to thank my mother, Roseanne Bellinar, and my father, Ron Bellinar, for being so supportive and pushing me to go to school all my life. I am proud of all that my classmates and I have accomplished and cannot wait to see what is in store in one of the most respected and trusted professions in the world. I would like to thank you all once again for coming to celebrate with us tonight, and God bless.
Hello, my name is Caitlin Reesner. I am speaking on behalf of the RN class of 2018. For the past 9 months, I have had the privilege of getting to know these young women before you. Although for some it has been a bit longer than that. Going into the RN program, I didn't know everyone but throughout the semesters, we have created a family. This family is full of mother figures, crazy aunts, sisters who you couldn't live without, and colorful cousins. It's a dysfunctional family, but we couldn't have done it without each other. They were there through the tears, the panic attacks, the stress, and the craziness that is nursing school. They will be who I think of when my mind wanders back to the memories of this year, not of the tests, the stress, or anything else. Well, there might be some of what I learned, and of course the teachers. These teachers, the men and women behind me, are the foundation of our nursing education and careers. They instilled in us the desire to be the best nurses we can be, to continue our education, to treat every patient as if it's our family member, to always remember airway, and to know that being a nurse is about serving others, whether that be physically, spiritually, or emotionally. We may have complained about them or disagreed with them, but they are the ones that molded us from students into nurses, and for that, we will be grateful. With that in mind, will you please stand up and give them a round of applause in thanking them? We also want to thank the hospital and the nurses on all the units who taught us while there. They answered our continuous supply of questions and helped us through our clinical experience. We are grateful for the hands-on experience and all that we learned there. Then the last people we want to thank is you, our friends and family. Thank you for giving us a shoulder to cry on, an ear to hear us vent, and a hug to know that you are there for us. Wait, I'm not done. We couldn't have gone through this year without you, and we thank you for that. I want to end with a quote from Florence Nightingale. She says, "Nursing is an art, and if it is to be made an art, it requires as exclusive a devotion, as hard a preparation as any painter's or sculptor's work. For what is having to do with dead canvas or cold marble compared with having to do with the living body, the temple of God's Spirit? It is the finest of fine arts." Thank you.
Good evening. I'm Melissa Fournier, the director of this fine program, and I am elated for these excellent graduates that we have. I would like to invite you all to join us for cake and punch in the Commons after the recessional. That's where the graduates will head, so please join us after they recess out. One group that I would like to thank by a round of applause is our partners from Mid-Michigan who did the blessing of the hands for us this evening. We really appreciate them being here and allowing us to do clinicals in their facility. When doctors graduate from med school, they take the Hippocratic Oath. Nurses don't have a Hippocratic Oath, but we have the Nightingale Pledge. The Nightingale Pledge is printed on the back of your programs if you want to follow along. And I'm going to now ask the graduates to stand, light their lamps, and face the audience as I lead the Florence Nightingale Pledge. Okay. One bank is good. I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous and will not take or knowingly administer any harmful drug. I will do all in my power to maintain and elevate the standard of my profession, and will hold in confidence all personal matters committed to my keeping and all family affairs coming to my knowledge in the practice of my calling. With loyalty will I endeavor to aid the physician in his work and devote myself to the welfare of those committed to my care. And now I would like to invite Jesse Samuel up for the benediction.
If you would like, please bow for the benediction. Dear God, as we celebrate this evening by honoring these LPN and RN graduates, we pray for the continuing dedication and determination that brought them this far. We ask that they bring to their work and life love and compassion on all who may need it, that they be defenders of life, that they have strength for those who are weak, courage for those who are discouraged, and to be a beacon of hope and care for those who have little. We ask this for these graduates and all who are in this vital field of work. May joy and blessings continue to fill their hearts wherever they may go from here. Amen.
This concludes our ceremony. If you could please remain seated as the graduates exit the gym.